Face is light and then have my face is dark. What's up, peeps? It's Dr. Talbert again. Welcome back to my channel. Today I wanted to talk about medical jargon. That is, words and phrases that we use in the medical community, specifically the doctor community. So a term that we use every day that may be confusing to people are the distinctions between an intern, a resident, and an attending. So an intern is a person who's in their first year after medical school, so they just started their residency. A resident would be someone who is beyond their first year of residency until they are finished with residency. So I'm a third-year resident in internal medicine. Next year, I will be an attending. And an attending is someone who has finished residency and now is able to practice independently. Generally, the intern and resident distinction is not super important anymore. It used to be, but it isn't anymore. But the biggest thing is that the difference between a resident and an attending. So again, resident, a physician that's still in training. An attending is someone who's finished their residency and now can practice independently. So that leads me to rounding. We round every day. The interns, the residents round with their attendings, and then if you're in a non-academic setting, you would be an attending independently, so you would just round by yourself. But rounding is when you go through the hospital and you see every patient that you're assigned to. We go outside of the room and we go over that patient's information, talk about what happened overnight, what were their labs, what were their physical exam today, and then what's the plan for today, and then we go into the room and talk to the patient. There are variations on this. Some people do what we call table rounds, so that means that we, instead of talking about the patients outside of the room, we talk about them in a conference room or somewhere with a table. We go through all of our patients, and then we go to the room and just go into the room and just talk to the patient. Sometimes the attending will leave the residents and do that part of the rounding on their own. Also, bedside rounds, which means that you do this entire process in front of the patient. So you go through the medical jargon, you go through, the physical exam, the labs, everything in front of the patient, instead of the alternative being that you go in, you talk to the patient only about the assessment and plan part. Another term that we use pretty much every day is run the list. Running the list means that you go through all of your patients that you are assigned briefly, and you basically just talk about the things that need to be done for the patient that day. So an example of running the list would be, I have patient X, we need to call interventional radiology to get this procedure done. We need to also switch her antihypertensive. We need to add a bowel regimen for her. And then we will go on to the next patient and say, this is patient Z. He is discharging today. We need to sign discharge orders. Those will be an example. So basically you just go through your entire list of patients and you go through what things need to be done, or sometimes, depending on who you're running the list with, you may also do updates. So for example, if I'm a resident, if I'm running the list with my interns, we generally don't go with updates because we're all aware of the updates as the day goes on because we're generally are with each other. But if we're running the list with our attending later, we would probably say updates. So we maybe say patient Z, blood pressure is under control now. She's ready for discharge. We'll sign the discharge orders. That would be a different example of running the list. But basically, you just go through every single patient that you have, and you talk about the to-dos or the relevant changes. This is another, I guess you would call it a phrase that we use. So this is WNL, which stands for within normal limits. So that basically just means that if there was something, a lab or a vital sign or something that was normal, you can just say WNL, or you can say within normal limits. I always hesitate to use WNL because when I was in med school, I had an attending tell me that WNL stands for we never looked. So basically meaning that if you don't know what the lab was, you'll say WNL, and he always thought that meant that you never looked. So he wanted you to give the specific number or the specific lab value instead of saying WNL. So it's not something that I use very often just because of that, but some people do. The term that we use on an everyday basis, and I'm sure most of you have heard of this, is NPO. But probably most of you don't know is that NPO stands for nil per os, and that's a Latin phrase. It basically just means nothing through the mouth. So the NPO is when a patient can't have any food to eat, And generally this is in preparation of a procedure. Those that we tend to use pretty often is a black cloud versus a white cloud. So generally this is referring to call shifts when you're staying, either overnight in the hospital or when you're doing the dreaded like 24 or 28 hour calls. So generally a white cloud is a physician or any provider who tends to have good overnight shifts. Meaning that, people don't come in super sick, you're able to get some sleep, you don't have a bunch of codes, just generally the shift is good. Whereas a black cloud is a person who can expect every one of their call shifts to be very bad. People are really sick, they're very busy, they get no sleep, basically everything's horrible. Another thing that we talk about is a bounce back. So a bounce back is basically a patient who you discharged from the hospital, but then they were readmitted to the hospital. So bounce back rules are going to differ based on what hospital you work at. Generally, at my hospital, for the internal medicine residency teams, our bounce back rules are for the entire month. Since we're on, from the first of the month to the last day of that month, we can get a patient back to us that we discharge for that entire month. For the other teams where the physicians are changing every week, the bounce back rules are less stringent. But for us, if I discharge someone on October 1st and they come back on October 25th, that will be a bounce back to my team. So that will be someone that we admit, even if we're not supposed to be admitting that day. Because in theory, we know the patient better than other teams would know them. And it probably is related to the same thing that they were recently admitted for. So that just makes it easier for everyone. Something else that we use generally at the end of the day when we're transitioning to the night team coverage is a checkout. So a checkout is just when you just give a one-liner, hopefully a one-liner. Some people don't give one-liners, but hopefully a one-liner on every single patient that you have that the night team will be covering for. And then a term that we use during these checkouts is called like a watcher. So those are generally your sickest patients, your patients that have the potential to decompensate overnight, meaning that, they could get into some trouble overnight or potentially more sick overnight or potentially die overnight or have to go to the ICU overnight. So those are ones that you want to pay special attention to. So speaking of watchers and talking about transferring patients to the ICU, that brings me into codes, or specifically a code blue, which is probably what you have heard of before. But basically that just means that when a patient has, I tend to think of it as when a patient has died. But basically when, a patient has become unresponsive, if you can't find a pulse, their heart has stopped, they've stopped breathing, that's when you call a code blue. And that's when you start CPR, other resuscitative measures, including and chest compressions, so that in hopes of bringing the patient back. And I generally refer to it as, bringing you back from death to patients, just so that we can understand the gravity of a code and how serious it is for people. Because essentially, I think of it as if your heart has stopped, if you stop breathing, you have died. And our goal is to bring you back as quickly as possible. In medical TV shows, we see codes that are pretty short, that, they overwhelmingly bring back the patients. But in real life, most codes end with a disability. A lot of patients don't make it through the code. And if they do make it back, like I said, a disability, so that, they may not have the same mental capacity that they had before. They may have some other disability now as a result of the code. So that's why I generally, when I'm referring to it as patients, I try to get them to understand that in a situation of them having a code, they have essentially died because their heart has stopped, like I said, and they have stopped breathing. That leads me to my final term, which I hadn't really heard of before this video. If you have, please leave a comment below and let me know where you heard it from. But as I was researching terms to talk about in this video, I ran across this term for internal medicine doctors. So some people refer to internal medicine doctors as fleas because a flea is the last thing to leave a dying dog, which I'm not sure if this is supposed to be a compliment or something that's supposed to criticize internal medicine doctors, but I think it's generally reflective of the care that you receive from an internal medicine doctor. We are, the doctors that are going to be there from the beginning to the end. So when you're really sick and you're at the end of life and we're trying to do all that we can for a patient, you'll find an internal medicine doctor there. Or when you're first admitted to the hospital and we're still trying to figure out what's going on with you, internal medicine doctors are there as well. So I think of it as a good term We are Fleas. We never leave our patients behind. We stay with them throughout the entire process. Thank you for watching this video. I really appreciate it. If you have heard of any other terms that you want me to talk about, make sure you leave it in the comment section below. Also, be sure to like this video and subscribe to my channel. I don't need to do that.